The stomach flu is back with a vengeance. We're seeing a surge in cases, the worst in a decade. This time it's norovirus taking center stage. This highly contagious virus is sweeping through communities, leaving a trail of illness in its wake. From schools to cruise ships, no one seems immune to its effects. Norovirus is notorious for its speed. It spreads rapidly, often before people even realize they're sick. This makes containment a significant challenge. The good news is that most people recover quickly. However, the sheer number of cases is putting a strain on healthcare systems. What's behind this resurgence? Experts point to a combination of factors. Relaxed hygiene practices after the pandemic, seasonal changes, and even viral mutations might be playing a role. Understanding this complex interplay is crucial for effective prevention and control. This isn't just another outbreak, it's a wake-up call. We need to be vigilant, informed, and proactive in our approach to norovirus. This means understanding the virus, recognizing the symptoms, and taking the necessary steps to protect ourselves and our communities. Norovirus is a group of viruses that target the digestive system. They cause inflammation in the stomach and intestines, leading to a range of unpleasant symptoms. The virus is incredibly contagious and can spread through various routes. Direct contact with an infected person is a common mode of transmission. This can happen through shared utensils, touching contaminated surfaces, or even inhaling tiny droplets released when someone vomits. Food and water can also become contaminated, especially in settings with poor hygiene standards. What makes norovirus particularly challenging is its resilience. It can survive on surfaces for extended periods and withstands many common disinfectants. This highlights the importance of thorough hand-washing and rigorous cleaning practices, especially in high-traffic areas. Understanding how norovirus spreads is the first step in breaking the chain of infection. By adopting simple yet effective hygiene measures, we can significantly reduce the risk of transmission and protect ourselves and those around us. The current norovirus outbreak is raising concerns among health officials worldwide, and we're witnessing a significant increase in cases compared to previous years, with some regions reporting numbers 3 times higher than usual. This surge is a cause for concern and warrants a closer look at the contributing factors. One possible explanation is the easing of COVID-19 restrictions. With the return to normalcy, people are interacting more, traveling more, and generally being less cautious about hygiene. While this is a positive step in many ways, it also creates opportunities for viruses like norovirus to spread more easily. Another factor could be the virus itself. Like many viruses, norovirus is constantly evolving. New strains emerge, some of which might be more transmissible or cause more severe illness. Scientists are actively studying these mutations to understand their potential impact on the current outbreak. The timing of this surge, coinciding with the winter months, is also noteworthy. Norovirus thrives in colder temperatures and lower humidity, making this a peak season for outbreaks. This emphasizes the need for heightened awareness and preventive measures during this time. Knowing the enemy is half the battle. In the case of norovirus, recognizing the symptoms early on can make a significant difference in preventing its spread. The virus typically announces itself with a sudden onset of gastrointestinal distress. Nausea is often the first sign, quickly followed by forceful vomiting. Diarrhea, often watery and profuse, is another hallmark symptom. Abdominal cramps and pain are also common complaints. Some individuals may experience fever, chills, headache, and muscle aches, mimicking flu-like symptoms. The incubation period, the time from exposure to the virus to the appearance of symptoms, is relatively short, ranging from 12 to 48 hours. This rapid onset means that individuals can unknowingly spread the virus before they even realize they are sick. Most people recover from norovirus within 1 to 3 days. However, it's crucial to watch for signs of dehydration, especially in young children and the elderly. These signs include decreased urination, dry mouth, dizziness, and fatigue. If dehydration is a concern, seeking medical attention is essential. Section 5. The ripple effect impact on communities and healthcare. The surge in norovirus cases is not just a personal health concern, it's having a ripple effect, impacting communities and healthcare systems worldwide. The highly contagious nature of the virus makes it particularly disruptive, leading to widespread absenteeism and strain on resources. Schools are often hit hard by norovirus outbreaks. The virus can spread rapidly among students, leading to school closures and disruptions in education. Similarly, workplaces experience a surge in absenteeism as employees fall ill, impacting productivity and operations. Healthcare facilities are also feeling the pressure. Emergency rooms are seeing a surge in patients with acute gastroenteritis, stretching resources and staff thin. Hospitals are implementing stricter infection control measures to contain the viruses spread within their walls. The impact on families is also significant. Caring for sick family members while trying to prevent further spread within the household can be challenging. The economic burden of medical expenses and lost wages adds another layer of stress. A Section 6 diagnosis dilemma, identifying the elusive culprit. Diagnosing norovirus can be tricky. Its symptoms often mimic those of other gastrointestinal illnesses, making it difficult to pinpoint the culprit based on clinical presentation alone. This is where laboratory testing comes into play, offering a more definitive answer. One common method is the polymerase chain reaction, or PCR test. This highly sensitive test detects the genetic material of the virus in stool samples. It's the gold standard for norovirus diagnosis, providing rapid and accurate results. Another approach is antigen testing. This test detects specific proteins on the surface of the virus. While faster and less expensive than PCR, antigen tests are generally less sensitive, meaning they might miss some cases. Despite these advancements in diagnostic tools, challenges remain. Access to timely testing can vary, especially in resource-limited settings. Moreover, interpreting test results requires expertise, as the presence of the virus doesn't always correlate with active infection. Section 7, navigating treatment, managing symptoms and seeking relief. There's no quick fix for norovirus. There's no specific antiviral medication that can eradicate the virus. Treatment primarily focuses on managing the symptoms and supporting the body's natural healing process. Staying hydrated is paramount, as the constant vomiting and diarrhea can lead to dehydration. Oral rehydration solutions are recommended to replenish lost fluids and electrolytes. These solutions are readily available over the counter and are especially crucial for young children and older adults who are more susceptible to dehydration. In some cases, intravenous fluids might be necessary, especially if oral rehydration is insufficient or not tolerated. This is typically done in a hospital setting to closely monitor the patient's condition. While there's no cure, certain medications can provide symptomatic relief. Over-the-counter anti-diarrheal medications can help reduce the frequency and severity of diarrhea. Anti-nausea medications can help control vomiting, making it easier to keep fluids down. Section 8, prevention, is key safeguarding yourself and others. In the battle against norovirus, prevention is our strongest weapon. By adopting simple yet effective hygiene practices, we can break the chain of infection and protect ourselves and those around us. Hand washing, the cornerstone of infection control, cannot be overstated. Wash your hands frequently with soap and water for at least 20 seconds, especially after using the restroom, before eating or preparing food, and after caring for someone who is sick. If soap and water are unavailable, use an alcohol-based hand sanitizer with at least 60% alcohol. Disinfecting surfaces is another crucial step. Norovirus can survive on surfaces for extended periods, so regularly cleaning and disinfecting frequently touched surfaces is paramount. Use a bleach-based cleaner or a disinfectant that is effective against norovirus. Food safety is equally important. Wash fruits and vegetables thoroughly before eating. Cook seafood, especially shellfish, thoroughly to kill any potential viruses. Avoid preparing food for others if you are sick, and wash your hands thoroughly after handling raw meat or poultry. Section 9, a collective effort, combating the outbreak together. The fight against norovirus is not a solitary endeavor. It requires a collective effort from individuals, communities, and healthcare systems working together to break the chain of infection and mitigate the impact of this formidable virus. Public health campaigns play a vital role in raising awareness about norovirus, its modes of transmission, and preventive measures. Educating the public about the importance of hand hygiene, safe food handling practices, and staying home when sick is crucial. Schools and workplaces can contribute by promoting hand hygiene, implementing sick leave policies, and ensuring proper cleaning and disinfection protocols. These measures can help prevent outbreaks and reduce the spread of the virus within these settings. Healthcare facilities are on the front lines, implementing stringent infection control measures to protect patients and staff. This includes isolating infected patients, using personal protective equipment, and reinforcing hand hygiene practices. The current norovirus outbreak serves as a stark reminder of the importance of public health preparedness and the need for a coordinated response. By working together, we can weather this surge and emerge stronger and more resilient.